contraindicated. But I think this chart will change because LAO will be maybe the predominant therapy in this part of the world. So we have good education platforms for our patients. So we have mobile apps to guide our patients so they can find a doctor and get appropriate diagnosis and get appropriate treatment immediately upon diagnosis. Okay, so in conclusion, AF burden is heavy in Asian population because of a large population, because of aging population, and projected increase in prevalence. Asian populations may have a higher stroke risk, more prone to bleeding, and stroke mortality and morbidity in Asian population is likely to be bigger than the European patients. Asian patients have they behave differently compared with Caucasians, for example, in the NOAC data. So most data scores, especially nowadays, are generated from the Western experience. So we need to tailor-make our risk scores. AF screening is important for conflict of interest. We will get more patients for occluders, actually. So the risk-benefit evaluation is very important. No matter it's a head-to-head comparison between anticoagulation and device or individual device may also be very important, and we have to study our population well before we make the very general conclusion. So thank you very much for your attention.
All right, because of the interest of time, we're going to have just one question. So I'm going to give you the reason of the prevalence of the stroke in Asia and Europe. So I think most of the reason is prevalence of the DOAC usage, or do you have some another genetic reasons?
For the higher stroke risk,
yes,
we take that into account and eliminate those confounding factors, so they still have a high burden of stroke in the Asian population. Actually, we study most of the Chinese population, and it's mainly from embolic, but it's not it's ischemic stroke. So some may say that there more is intracranial atherosclerosis in this part of the world, so that make the patient more prone to a stroke. So they don't break into this is embolic stroke or intracranial stenosis, but overall the stroke due to ischemia is high in this part of the world.
Okay, thank you very much.